Hi everyone, welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm your host, and I'm also the Dean at the Arizona College of Podiatric Medicine. Our guest this week is Dr. Allan Boike, the Dean at Kent State University College of Podiatric Medicine. Dr. Boike has been a longtime leader in our profession. His roles have included being a residency director, a professor at the Ohio College of Podiatric Medicine, a contributor to national organizations such as the American Board of Foot and Ankle Surgery, the National Board of Podiatric Medical Examiners, and the American Association of Colleges of Podiatric Medicine. Dr. Boike did his undergraduate work at Michigan State and Wayne State Universities. He graduated from the Ohio College of Podiatric Medicine in 1982. He completed his surgical residency training at New Berlin Memorial Hospital under one of the great pioneers in our profession, Dr. Richard Hecker. Welcome to Dean's Chat, Dr. Boike.
Thank you, Dr. Jensen. I really appreciate the offer of being here, and I'm looking forward to chatting today.
We'll have a lot of fun. You know, in keeping with the Dean's Chat, fireside chat theme, let's keep it informal, and for the rest of the discussion, you be Allan and I'll be Jeff. How's that sound?
That sounds great to me.
All right, let's get started. Allan, if you wouldn't mind, share your path and journey into podiatric medicine, and if you also don't mind saying a few words about your family, I think the audience would appreciate that too.
Sure, that'd be great. I think it's interesting. I think so many of us had a kind of a different path into podiatric medicine than most allopathic or osteopathic physicians, and mine was probably a little different than most. I would consider myself a non-traditional student from the standpoint of I didn't go directly from undergraduate school to the College of Podiatric Medicine. I actually went to Michigan State undergrad. I was a first-generation student from my family, so no one in my family had ever gone to college before I went to college. My mom and dad both actually grew up during the Depression, and they never finished high school. As a matter of fact, both of them had to essentially go to work after 8th grade. So neither of them had a high school education or for sure a college education. My dad was drafted into the Army during World War II and served during World War II, came back, and through the Veterans Administration, through the VA plan, he became an electrician. And we grew up in a middle-class family. But it was always his goal to have one of his kids at least go to college. And I had an older brother and sister. They both graduated from high school and kind of decided to get married and go out into the world. They were 11 and 12 years older than me, so it wasn't unusual at that time for people not to do that. But my dad would come in and tell me every night when I was going to bed that I was going to college and I was going to do something more than everyone else had done. And he kind of was the role model that got me to go to college. So I went to Michigan State undergrad. I studied chemistry. Then I went to Wayne State and actually went to pharmacy school there and got a pharmacy degree, practiced pharmacy for 3 years, and then decided to go back to school and went to the Ohio College of Podiatric Medicine. And by the way, when I decided to go back to become a podiatric physician, I think that's when my dad figured out that maybe he had talked to me too much about education because he was wondering if I would ever stop getting educated. And the fact is, I don't think I ever did stop getting educated. So it was an interesting journey. But I think the way I found podiatry was maybe even more interesting because even though I was in a healthcare profession as a pharmacist, I knew nothing about podiatric medicine. As a matter of fact, they never talked about it when I was a pharmacist. I'm not even sure that I knew it was legal for a pharmacist to write a prescription, and I'm not sure that I would have filled a prescription for a pharmacist or for a podiatrist at that time because I had no clue what they did. And I was working at a large hospital in Detroit, Henry Ford Hospital, as a hospital pharmacist. So I really knew nothing about podiatric medicine until one day when a pharmaceutical rep came in and was talking to me and said, you know, you seem kind of bored being a pharmacist. Have you ever thought about becoming a podiatrist? And I said, a what? I'm not sure what you're talking about. So he kind of explained it to me, and he had several podiatrists that he called on, and he set up some shadowing experiences for me. And I guess the rest is history. From there, I decided to apply and go to OCPM. And that was kind of my path to finding podiatry. And I'm not sure we still don't have the same problem today, in that a lot of people don't know what we do and what a great profession this is.
Well, let's talk about that. So when you hear the initials Doctor of Podiatric Medicine, DPM, what does that mean to you, Allan?
Well, that means to me somebody who's specifically trained to treat lower extremity, foot and ankle injuries, problems, and they're the people who are the expert at doing it. And that's what kind of drew me to the profession, was that I knew from the beginning what I was going to be. It wasn't like applying to allopathic or osteopathic medicine and at the end of the 4 years kind of guessing what I might be. I could end up being an orthopedic surgeon. I could end up being a family practitioner, a pediatrician, but there was no guarantee that when I finished, I would be what I wanted to be. So podiatric medicine offered kind of that straight path to a specialty, which I like.
Right. And I think students like that today also.
Yeah.
So obviously your father was the ultimate mentor. I mean, you're very fortunate. But one of the common themes I see in everybody I'm interviewing on this podcast is that everybody has one or multiple mentors that have made just a significant difference in their career. Could you comment on that? Who were your mentors, Allan?
Absolutely. I think we all kind of stand on the shoulders of the people who came before us. I know it's kind of cliche, but it's true. And so I would tell you that I had probably 3 or 4 mentors during my career and at different points in my career. When I was in podiatry school, Larry Fallett, who's a podiatrist in Detroit and runs a program and has run a program not there now for over 40 years, has a great program. I happened to shadow him after I started college, after I started podiatric medical school. And he really influenced my thought processes and where I wanted to go and what I wanted to be. When I first came to school, having been a pharmacist, I wasn't sure that I wanted to do surgery or if I wanted to be a medical specialist to kind of do podiatric dermatology, because when I worked at Henry Ford Hospital, I actually worked in a dermatology floor for a while. But as I worked with Larry, I began to see that the path that I really wanted was, foot and ankle surgery. So he was probably my first mentor from that standpoint. And then Rick Hecker was just a guy who, if you ever met him, he influenced you, I think. And the time I spent with Rick was extremely influential in my career. I think that I just saw more potential as things went along. And once I got into practice, and I practiced actually in private practice for about 3 years before I came back to the Ohio College of Podiatric Medicine and became a member of the surgery department. Once I got here, probably the biggest influence on my career was Gerard Yu. And although Gerard and I were contemporaries, Gerard had an amazing, I don't know how to say this, an amazing facility for teaching and also for surgery. And I learned so much from Gerard. Eventually, we went into practice together and practiced for several years together before I went to the Cleveland Clinic as the head of their podiatry section there. And then James Hall came along. Jim Hall, who had actually taught me at the school when I was a student, was the head of the section at that time. And he kind of showed me the ropes on how to maneuver through a large medical institution. And the Cleveland Clinic is a large medical institution. So Jim gave me some great insight as to the politics and how to maneuver in that particular situation. So I would say those are probably the 4 big mentors that I had in my career.
It's interesting because the more mentorship that we have, the more apt we are to land in academics. And
it is true. I think that's true.
I think it's fascinating. So even though you're in private practice and you had gone back and you joined the surgery department, tell me about that journey. Was that a hard decision, or was it just a natural decision to go into academics and teaching?
It's an interesting thing. I actually, when I finished pharmacy school and went to work at Henry Ford Hospital, I actually became an adjunct faculty member at the College of Pharmacy at Wayne State. So I started teaching just about the time I finished my initial undergrad training. And it just seemed natural to me. I enjoy kind of spreading the knowledge that I have. Some people may not think it's that much, but I like to try to spread it around. And I knew as soon as I finished my residency training and went out to practice, I wanted to be involved with residency training. So I was involved with residency training. And when the opportunity came up to come back to the college and teach, it was a natural for me. So I was happy to have that happen.
So being involved in academics so early in your career, you saw tremendous evolution, not only in the profession, but at the Ohio College itself.
Absolutely. When we first started, when I first got out of residency training and came back to the college, it was still a struggle to get hospital privileges as a podiatric physician surgeon. So even with the best of training, a lot of hospitals denied us privileges. We had to fight for those privileges. And the evolution that has occurred since then is now, every student who finishes or every resident who finishes pretty much can walk into a hospital and gain hospital privileges at pretty much any hospital they want. And that took a lot of, battles in fighting to get that done. But the bottom line is it was worth every moment of the fight because it's evolved the profession significantly.
That's interesting because the docs just a little older than I am, fought that battle in Denver, Colorado, and throughout Colorado. Dr. Hatch, of course,
right.
Dan. And I'm very appreciative of all those efforts because when I moved to Denver, coming out of Kern Hospital in 1993, it was just like you said. I just applied for hospital privileges and got them. And certainly, I think the younger generations have to appreciate the battle that the prior generations fought for them to get those privileges.
And the people who were running residency programs when I graduated from school had fought those battles, obviously, to get where they were at. But probably the 2 decades from the early 70s to the early 90s were the times when those battles were fought and fortunately won for us.
That's fantastic. So I want to kind of speed along or fast forward the story now. So you're working Cleveland Clinic, you're a residency director, you're at the Ohio College of Podiatric Medicine in the surgery department. Tell me about the transition to coming up to being the dean. You've been the dean now since when, 2014 or so?
That's correct, since 2014.
How'd that play out? And specifically, let's talk about the skill sets that deans need as opposed to being a faculty member.
Well, it's kind of an interesting thing. I never really ever thought about becoming a dean. I had left academia for a while from the standpoint of being at one of the colleges. I was at the Cleveland Clinic. I was very happy with what I was doing. And again, sometimes opportunity kind of knocks on your door, and that's what happened with me. I was contacted by a search committee and asked if I had an interest. And initially, I kind of questioned whether I should do that or not because I was well established and had a great practice at the Cleveland Clinic. But then I thought a little bit more about it and thought there's an opportunity here to maybe help change and advance the educational process even more. So after some long thought and prayer, I decided that I would apply for it and was fortunate enough to gain the position. And once I got there, I realized that there was a lot of things I didn't know about being a dean. There is so much that goes into being a dean that I think people don't know. It's like how the sausage is made. Nobody knows exactly what's going on. But when you get there, you start to quickly figure it out. And so I got to Kent State and realized that being the dean was more than just kind of running the educational process of the college, because Kent State's a rather large institution. There are essentially 12 other colleges, and I was expected to intermingle and work on the academics, not only at the College of Podiatric Medicine, but be involved with the College of Nursing, the College of Architecture, things I really had not a clue about, to tell you the truth. And so it was a real learning experience for me the first couple of years, because I was running back and forth. We have a separate campus. We're about 30 miles from Kent's main campus. And so we're kind of an isolated campus, but still considered part of Kent's main campus. And because of that, I got to drive back and forth, 30 miles back and forth to dean's meetings. And the deans all meet on a regular basis. We generally meet 2 to 3 times a month at least, where all the academic leadership from Kent State is there. And we discuss all academics across the entire scope of the university. So that was something I hadn't really expected, and it was enlightening, and I really enjoy it because it gives me some insight as to what happens on the larger university scale. But then you still have to run the College of Podiatric Medicine,
right.
And that was an interesting transition for me. Running the entire budget for the college, making sure that the faculty was getting everything that they needed, the students were getting everything that they needed. So as a dean, I kind of consider myself a facilitator more than anything else when it comes down to it. And so my job here is to facilitate making sure that the students get the optimal education and that the faculty and staff have everything that they need to get that done. So
I like that. In fact, one of my next questions was, I was going to ask you about your leadership style and a facilitator, a collaborator, that I can see you being extremely good at that.
I think that you can't function if you can't collaborate and facilitate. And I'm sure you know that,
Absolutely.
Jeff. It's I don't know if it's a skill. I think it's something that you almost have to innately have. You have to look at this as being kind of a servant to everybody to get everything accomplished. And I think everybody has to work cooperatively, because this is a team effort when it comes down to it.
I agree. I think there's a lot of, it's in the blood. There's some innate leadership qualities that individuals have. But I agree with you. There's a tremendous learning curve there. I had the same learning curve, and it's not easy.
It is not the same as being in practice. And I have to tell you, I still practice. I see patients in our clinic on an abbreviated basis, 1 day a week, because everything else takes time, as you know. But I will tell you that I enjoy that 1 day in seeing patients more than I ever did when I was in private practice, because now it's almost a privilege for me to go down and take care of patients. I took that for granted for a long time. And it's an opportunity for me to, number one, go down and treat those patients, but it's also an opportunity for me to work directly with the students and get to hear what they're thinking about what's going on at the college, and to work with faculty members in the clinic, so I know what they need. Again, I can see what's going on. They can't say to me, well, you don't know because you're not there, because I am there.
Right. And they can't turn to you and say, Dr. Boike, I never learned how to write a prescription, because you asked them to do it for you.
That's exactly right.
So let me ask you a question about the transition from the Ohio College of Podiatric Medicine to Kent State. Now that had to be a difficult transition. There's no such thing as an easy transition, right? What are some of the pros and cons of being affiliated now with Kent State?
Well, it's interesting because I came in kind of at the cusp of the transition. So they were Kent State by the time I got here, but they had just barely become Kent State. So 2012 was the acquisition. 2014 I took over, and they were still in the midst of the transition. And it's a little bit of a culture change when it comes down to it, because having been a self-contained unit for almost 100 years, you can imagine that there's a certain culture that is built into that. And so people weren't used to a much more autonomous situation, I suppose. They weren't used to going to Kent State to get approval for things. And so we had to do that. And we've did that over a period of time. And I would say that transition actually took probably another 2 or 3 years after I got here for people to get used to saying, we are Kent State. I think one of the more interesting things about the transition was that our alumni were kind of recalcitrant to the change. It wasn't that they didn't want Kent State to, kind of take over OCPM. It was that they were OCPM grads. They weren't Kent State grads. And I kept trying to convince people, it's the same thing. We've just kind of changed names. If you're a business and you change to a DBA, doing business as, you're still the same business. You just have changed the name. I think the way I finally got people to understand, or at least kind of become more accepting, is I decided that maybe we should reissue all their diplomas.
Oh, very good.
And so they all received, or they were offered the opportunity to receive a Kent State University diploma with their degree of DPM. And I think that helped people kind of look at it and say, I guess I am really Kent State. So I'm going to take a quick sip of water here, if you don't mind.
That was a brilliant move, Allan. And I say that because I went to the California College of Podiatric Medicine, and they've gone through their own transitions, right?
Right.
And now they're the California School of Podiatric Medicine at Samuel Merritt. So there is a little bit of a disconnect there, and I think that diploma decision was brilliant.
The only thing, the weirdest part about that diploma, and I'll tell you, this is a secret between just me and you, because nobody else is watching, but so I actually got one of the diplomas. And I may have the only diploma in the country that is signed by myself.
Oh, there you go.
So my signature is as the dean on my own diploma, which kind of looks a little suspicious, I suppose.
Yeah, if you only knew many years ago predicting the future, right? So Allan, if you were to say, if you had to pick one thing, what is your favorite thing about being the dean at Kent State?
The students.
Yep.
Yeah, I think working with the students and watching them grow, from when we first do our white coat ceremony, we do that our first week here, to when they graduate, to me is the most gratifying thing. My 2 favorite days of the year, I tell people now, are white coat ceremony and graduation day. Other than holidays, obviously, that we have. But to me, as they cross that stage, and Jeff, I'm sure you have the same feeling, they cross that stage and you shake their hand and you just feel like, boy, we've accomplished something here. And to me, that's the greatest feeling in the world.
Yep, so I agree with you. And you and I have worked together so much over the years. I fully appreciate your student first philosophies, and I try to emulate them also. Just a side comment, it's amazing to go to meetings like we did in Los Angeles, the American College of Foot and Ankle Surgeon meetings, and your old students are up there giving podium lectures. And it's like watching your kids grow, and I'm so proud of them. It's great.
That is probably so gratifying for me to see that happening. And you just think, boy, this profession has just advanced so much as I watch this. And it's sometimes it almost, you almost want to cry because you see this happening. Absolutely. It's a great feeling.
Oh, I agree so much. A different line of questioning. Over the years, you've been a servant leader, and you've played important roles in national organizations within the profession. Do you mind touching base on a few of those, like your role with the American Board of Foot and Ankle Surgeons?
Yeah, probably, again, one of the more gratifying things I've ever done. I think that next to training residents and students, being part of ABFAS was just a fortuitous thing for me. It gave me an opportunity to meet so many leaders in our profession. But more than that, I looked at ABFAS as an organization that I felt like I've never been a real, for lack of a better, politician, but this was something that was purely educational from a standpoint of trying to make sure that we were bettering the profession. And to me, making sure that those exams were done right. I was a committee member for the written exam for years, for the computer-based exam. I was an oral examiner, a case reviewer, communications committee chair, and those things, and a member of the board of directors. All those things, just there was a fulfillment in watching what was going on, and you just saw the profession growing. Another way that you could just watch this profession grow. So ABFAS, to me, was a great organization, and it was very fulfilling for me from that standpoint. And now AA, AACPM.
Yes.
Not everybody gets an opportunity to be on that particular, board, but as a dean, the collegiality and working together that we do as a group of deans. I know a lot of people probably think we're very competitive with each other. But the truth is, I think this is another group of people who are just trying to grow the profession and make the profession better as we go along. And I enjoy working so much with the deans. It's just I'm humbled by working with people I get to work with.
I feel the same way. And, come July 1st, I'll be the chair and you'll be the vice chair. So we'll be working together all the time.
And I'm really looking forward to that. I think there's a lot of great things we can get done. So
I agree. I'm really looking forward to it too. Another organization you've been involved with to this day, the National Board of Podiatric Medical Examiners. Can you share with me your experience with them and the impact that has on our profession?
Yeah, it's interesting. I was thinking back about my experience with them, and it actually goes all the way back to when I started teaching at the college. I was a member of the surgical test committee. And I remember going to Princeton, where they used to hold their meetings, and you'd be there all weekend writing test questions and going over test questions. And at the time, you start to begin to realize the importance of, the NBPME from the standpoint of, they're essentially the pathway to licensure. So they have a big responsibility. I would say that, as a dean and a group of deans, we may not always see eye to eye with everything that they're doing, but the bottom line is they have a very important responsibility within the profession. And so I think that their role is vital, and we're here to help support that.
Absolutely. It's another one of those all hands on deck kind of opportunities for us to make a difference.
Absolutely. So,
all right. Well, I wanted to comment on a couple things. You're very humble, so I wanted to take a couple minutes to highlight some awards you've received and get your feedback on them. You are a Hall of Fame inductee into the Ohio College of Podiatric Medicine. What was that like?
Well, I never thought that would happen, to tell you the truth. I think back as a student, and I'm not sure anybody ever thought I would be in the Hall of Fame at OCPM or KSU CPM, but I'm humbled by that honor. And the people who are in that Hall of Fame are names that have, set the standard for podiatric medicine. And for me to be included in that group is just, I don't know, it's awesome, I guess is what I would say. I never thought I'd get that chance.
Awesome is a great term. More recently, you were given a Lifetime Achievement Award from the Greater Pennsylvania Educational Foundation. How did you find out about that?
Well, it's kind of interesting. I didn't know that was going to happen. And some of you may know Mark Hofbauer, but Mark was, I think at that time, the president of the foundation. And one day I got a call from him, and Mark's one of my previous students. And when he told me, I was like, I don't even understand. I don't even know what to say. This is an amazing award. And I was fortunate enough to go to their meeting and give a small lecture and receive the award. And you've just got, again, these giants of the profession who are there, Alan Cantanzariti and Jordan Grossman. And I don't want to forget anybody, but it was just like a who's who of folks from at least this area. And again, you're awestruck to be even honored like that. So
well, congratulations. I
appreciate that.
I speak for the profession that we appreciate all you do on behalf of the profession. That's incredible.
And you too.
Well, so every year, all doctors need to get continuing medical education units. And, a lot of people dread going through that, and it's, 26 credits or 20 credits, depending upon where you are. But Kent State has offered an opportunity to get CMEs at a wonderful conference in Florence, Italy. Tell me about that. How did that come about?
So that got set up in 2015, I think, was the first year we did it. It came about because Kent State, one of the opportunities and one of the I guess the things that's great about being at Kent State is Kent State has a campus in Florence. And so a lot of undergrad students go there. Vince Hetherington, who I was working with at that time, had been kind of working with Kent State. And together we came up with this program in Florence. And Vince was a big driving factor, but the program was set up with several physicians in Florence, diabetologists mainly, but some sports medicine docs. And we decided to put this program on. So we put on a joint program with Italian physicians and podiatrists from here in the United States. And we've been doing that every year now since then, except for the COVID years, of course, which interrupted us. But it also led us to another opportunity. So our students in their fourth year now are able to do one of their clerkships in a hospital in Arezzo, Italy, in Tuscany, which isn't a terrible place to do a rotation.
Sign me up. Sign me up.
Yeah, exactly. So that program was about to start in March of 2020.
Oh, geez.
And our first student flew into Rome. And when she got to Rome, they said, I'm sorry, you have to get back on a plane and go back to the United States because of COVID. So it got delayed for almost 2 years, and we've just started it up. We'll be starting it up in July. So our first students will be going in July.
What a wonderful
another opportunity.
Yeah, absolutely. So let's shift gears again. Tell our audience something that they wouldn't know about you, maybe a hobby or a passion that you're involved with.
Well, I love basketball. And I coached basketball. I coached middle school basketball for 15 years. And I actually just stopped 2 years ago. Things just got a little busier than I could handle. And it actually was a pretty significant commitment from about November 30th to March 1st. We had practices 3 nights a week and played on weekends. And so I really enjoyed it, had a great time. But it interfered with a lot of other things. Like my wife was asking, why can't we go on vacation anytime between November and March? And I finally had to relent and say, we're probably going to have to give one of these things up.
Did you play a lot of basketball when you were younger?
I played in high school. So I was probably a mediocre basketball player, but I did have one thing. I could still actually touch the rim on my 60th birthday. So I felt that was an accomplishment from just that standpoint.
That's fantastic.
I'm not sure I can touch it anymore.
No, I have a hard time touching the net, but I'm a huge basketball fan too. And I just am loving it that the Milwaukee Bucks have turned it around after like 50 years of futility.
Amazing.
Very good.
They're amazing.
All right.
I'm looking forward to the tournament, the NCAA tournament.
Oh, me too. I've got my brackets in already. So back to business. Let's talk about the applicant pool in our profession. There's a little bit of a conundrum, in my opinion, because if you're a student and you go and you shadow a doctor of podiatric medicine, you come away from it so excited and you want to be a podiatrist. But that's not translating to an increase in the applicant pool. And Granted, COVID was there and there weren't the shadowing opportunities, but what are your thoughts on the applicant pool and what can we do to increase it?
I think we're just starting to do what we need to do. I think we need to get out there and let people know what this profession does. We haven't done a good job of that. And so I think that we need to just tell people what this profession does and how important it is. They don't realize that right now. I think many people don't know the difference between a podiatrist and MD and DO. And they just know that you're the foot doctor. You're the guy who takes care of their foot and ankle. But we have to make sure students know that and younger people know that so they apply. And I think if we show them that and we give them appropriate shadowing opportunities, I think we'll do fine.
I agree. I've got a fun story for you. Past summer, I was up in Montana and I took the opportunity to go to Bozeman and go to Montana State. And I met with their health advisors, and lo and behold, one day I am walking through the hall and our admissions department's giving a tour to a student. So I started talking to him and I said, well, where are you from? He said, I'm from Montana State. And lo and behold, it's nice to see some results from stopping in and educating people about the profession. But Allan, some of these universities, they don't even have podiatry on their websites as an option for health.
No, that's exactly right.
For health careers. So I think there's a lot of work to be done, and I think it's one of those all hands on deck, and I appreciate what you're doing, and our school and our students are involved. So I think we're going to turn it around here. Yeah,
and I think everyone in the profession needs to kind of chip in. It's all, like you said, all hands on deck. I think before that's what it is. We need to make sure that everyone gives students an opportunity to shadow in offices and things like that.
I agree. Let's reverse roles. Do you have any questions for me?
Yeah, John, I think my big question for you is, how did you decide to do this podcast? Because I think it's such a great idea.
Well, I was exposed to some podcasting by my son, and when I saw the studio and I realized that it really wouldn't be that hard to do to get more exposure for our profession, I thought I'd give it a try, right? And I didn't know how it was going to work out at all. But I really think that the leaders in our profession, and I'm not just talking about the deans or administrative folks, I'm talking about residency directors and clerkship directors and the people that train our graduates to become doctors. They're like unsung heroes, right? So I'd really like
Absolutely.
to give everybody an opportunity to be recognized, to talk about them, to see what makes the world go round in all facets of our educational process. And also, I wanted to highlight some of the organizations. I mean, AACPM, the American Association of Colleges of Podiatric Medicine, plays such a crucial role in the educational process in our profession. Or
Absolutely.
the Council on Podiatric Medical Education with accreditation, not only for our colleges and schools, but for CMEs, for residency programs. So there's so many areas of our profession that we can talk to leaders about and find out more. And hopefully our students will be involved, and prospective students will see this type of an interview. And I don't think there's a downside to it, Allan. It's for me, it's easy because I get to bring on guests like you. That makes it very easy. And then the folks I'm working with here at the studio put it out on Spotify and Apple Podcasts. So I've been very fortunate in that regard. But thanks for asking.
No, I love the idea. I think it's a great thing. And I think, again, this helps us kind of disseminate the information people need to have out there. They need to know what we do and what's going on. So I think it's a really important thing that you're doing here.
Well, thank you. And thanks for being on the show, of course. Are there any final thoughts for our audience that you have, Allan?
No, just I would tell you that I think this is one of the greatest professions in the world. I can't believe that I didn't know about it until I was 27 years old, or almost 27 years old. And we need to let people know what we're doing. I think that's really an important thing.
I agree with you, Allan. Well, I wanted to thank you for your time and your knowledge and your expertise today. I look forward to putting this podcast out for everybody in the profession to hear.
Well, thank you so much for the opportunity. I really enjoyed it. So,
well, thank you, Allan. Thanks for being on the show. I also want to thank all of our listeners today for joining us on Dean's Chat, all things podiatric medicine. Each week, we will bring you voices of leaders in our great profession. I will see you next week. Don't forget to give us a 5-star rating, and cheers to everyone. Bye-bye now.